Hello everyone, I am Dr. Simone Atkinson with Get to the Point Nursing Notes, and today's lecture is on mastering some of the most frequently tested drugs on NCLEX. So this is part one of a multi-part series where I will cover the frequently tested drugs, and I will review the high-level information that you need to know about each drug and then test your knowledge with 2 to 3 practice questions after reviewing each drug. So let's get to the point of what we need to know about these drugs. So the first drug classes we will cover are antiplatelets and anticoagulants. Clopidogrel plays a crucial role in preventing blood clot formation and reducing the risk of heart attacks and strokes. So it works by inhibiting platelet aggregation and prevents platelets from clumping together. Clopidogrel is commonly used in individuals who have experienced a heart attack, a stroke, or are at higher cardiovascular risk. And its primary purpose is to help thin the blood, reducing the likelihood of clot-related events. So while taking clopidogrel, it's important to monitor for potential side effects. The side effects include bleeding, so have clients keep an eye out for signs of unexpected or unexplained bruising or bleeding gums. Monitor for neutropenia, which would be a sign of an infection. Monitor hypercholesterolemia, and this is monitored by reviewing lipid levels. Monitor for thrombocytopenia because there is a risk of low platelet count. The nursing implications include monitoring clients for any signs of bleeding, emphasize the importance of taking the clopidogrel exactly as prescribed, and assess for potential drug interactions, and caution clients to avoid other blood thinners unless specifically prescribed by their healthcare provider. They should conduct regular CBC and platelet count assessments, and before any surgery, clopidogrel should be discontinued typically 5 to 7 days before the procedure to minimize the risk of excessive bleeding. Patient education should include essential safety information, so make sure clients are aware of signs of bleeding, such as blood in their urine, stool, or coughing up blood. Caution them to avoid activities that can lead to injury or bleeding, such as high contact sports, and advise against certain supplements like garlic, ginkgo biloba, and ginger because these can interact with clopidogrel. Special populations such as children, pregnant individuals, and lactating women should avoid the medication unless specifically prescribed by a healthcare provider. A nurse is caring for a client prescribed clopidogrel. The client is scheduled for elective surgery in 10 days. What order from the healthcare provider should the nurse anticipate? A. Advise the client to discontinue clopidogrel 5 to 7 days before surgery. B. Monitor the client's platelet count and resume clopidogrel a day before surgery. C. Educate the client about the importance of continuing clopidogrel without interruption. Or D. Administer an anticoagulant to enhance clopidogrel's effects before surgery. The correct answer is A. Discontinue clopidogrel 5 to 7 days before surgery. So when managing a client's clopidogrel medication, recall that it inhibits platelet aggregation, and the nurse should advise the client to discontinue the clopidogrel 5 to 7 days before surgery. This is the recommendation to minimize the risk of bleeding complications during the surgical procedure. Now, option B, monitoring the platelet count and resuming clopidogrel a day before surgery, that does not align with the typical protocol for this medication. And option C, educating the client about the importance of continuing clopidogrel without interruption. That is an essential education for the client in general management of the medication, but this has to be adjusted before an elective surgical procedure. And option D, administering an anticoagulant before surgery, is not a standard practice and may lead to excessive bleeding. A nurse is caring for an older adult client on clopidogrel who started taking ginkgo biloba supplements for memory improvement. She has recently started having frequent nosebleeds. What should the nurse advise the client to do regarding the use of ginkgo biloba? A. Continue taking ginkgo biloba for cognitive function. B. Stop taking ginkgo biloba and monitor the nosebleeds. C, give an over-the-counter antihistamine for the nosebleeds, or D, arrange an immediate neurological assessment. The correct answer is B, stop taking the ginkgo biloba and monitor the nosebleeds. When assessing and managing a client who's experiencing nosebleeds while taking ginkgo biloba, the nurse should prioritize B, which is to stop taking the ginkgo biloba and monitor the nosebleeds, because ginkgo biloba is an herbal supplement that is known to have blood thinning properties, and it's, similar to Clopidogrel, which is an antiplatelet medication. So when used together, there is an increased risk of bleeding, which would include nosebleeds, because both substances can impair the blood's ability to clot. So this action evaluates whether the ginkgo biloba is contributing to the nosebleeds by stopping it. So encouraging the client to continue ginkgo biloba, which was option A, without addressing the nosebleeds is not appropriate. And then administering an over-the-counter antihistamine, which was option C, may not be effective for a nosebleed, especially when it's related to ginkgo biloba use. And then arranging an immediate neurological assessment, option D, is not indicated just because the patient or the client has nosebleeds, and would only be considered if the client had a cognitive function impairment while they were bleeding from taking both the Clopidogrel and the ginkgo biloba. Enoxaparin is a medication commonly known as Lovenox, and it has a role in preventing and treating blood clots, in particular DVTs. So enoxaparin is prescribed to prevent DVTs, and the overall goal is to reduce the risk of clot-related complications. Side effects. So enoxaparin is highly effective, but it does have some side effects, including bleeding. So it's important for the nurse to be on the lookout for signs of bleeding. It also can have thrombocytopenia as a side effect. So regular monitoring of the CBC count in order to ensure that the platelet levels remain normal is important. A few nursing implications. So enoxaparin should always be administered subcutaneously, never by IV or intramuscularly. And we should always assess for contraindications before administering the enoxaparin for that dose. For example, if the patient was going for a surgical procedure that day, or they were going to have a tracheostomy, or let's say they had an epidural catheter for pain, and the plan is we're going to maybe take that catheter out for the day, we would want to assess that there are no contraindications to giving the enoxaparin before we actually administer it, or maybe the platelet count is low. We would want to speak with the physician. So enoxaparin is especially beneficial for patients who are immobile, and it helps to prevent those blood clot formations. And there's generally no need for a routine lab testing to monitor a level of enoxaparin in the blood. So when administering enoxaparin, we just have to ensure that you're giving it at least 2 inches away from the umbilicus or any abdominal incision site to minimize the risk of any bleeding complications. And as an antidote, we can also give protamine sulfate if there is excessive bleeding or signs of a possible overdose with enoxaparin. It is a low molecular weight heparin, so protamine sulfate can be given to help reverse some of the effects of bleeding if there is an accidental overdose or excessive bleeding. A nurse is preparing to administer enoxaparin subcutaneously to a client for the prevention of deep vein thrombosis. What is the most critical nursing action before administering enoxaparin? A, verify the client's blood type. B, administer the medication intravenously for quicker effect. C, assess the client's platelet count with a complete blood count. D, check the client's respiratory rate and oxygen saturation. The correct answer is C, assess the client's platelet count with a complete blood count. So the most critical nursing action before administering enoxaparin is to assess the client's platelet count with a complete blood count. Enoxaparin, like we said, can lower platelet levels, and monitoring for thrombocytopenia is essential, and the other options are not directly related to the medication's administration or the potential side effects. A nurse is educating a client who is prescribed enoxaparin for the prevention of deep vein thrombosis. What important information should the nurse include in the teaching? Select all that apply. A. Enoxaparin should be administered intramuscularly to ensure proper absorption. B. You should apply pressure to the injection site after administering enoxaparin. C. It's important to monitor for any signs of bleeding, such as bruising or bleeding gums. D. Avoid taking any over-the-counter pain relievers while on enoxaparin. And E. Report any unusual or severe headaches immediately to your healthcare provider. The correct answers are C. Monitoring for signs of bleeding is crucial while on enoxaparin. And E. Unusual or severe headaches could be a sign of a bleeding-related issue, and they should be reported to the healthcare provider promptly. We know that A is incorrect because enoxaparin should be administered subcutaneously, not intramuscularly, for proper absorption. B is incorrect because pressure should not be applied to the injection site after administering enoxaparin, as it can cause or it would have an increased risk of bleeding. And D is incorrect because while it is essential to consult with a healthcare provider before taking any new medications or supplements while on enoxaparin, avoiding all over-the-counter pain relievers may not be necessary. Warfarin is a widely used anticoagulant which operates by acting as a vitamin K antagonist, and it plays a crucial role in preventing blood clots, and it is prescribed for various conditions including DVTs, pulmonary embolism, heart attacks, and stroke. So warfarin functions again as a vitamin K antagonist, and it interferes with the body's ability to form the blood clots effectively. So in case of excessive anticoagulation or bleeding, the antidote for warfarin is vitamin K, and it's important to note that vitamin K rich foods, especially greens like kale, should be avoided while a client is on warfarin therapy. Now, warfarin serves the following clinical purposes: anticoagulation to prevent blood clots in various medical conditions, and management of conditions such as DVT, pulmonary embolism, heart attack, and stroke. So nursing implications include regular monitoring of the INR, or the International Normalized Ratio, in order to maintain a therapeutic level target range of 2 to 3. Heparin may be given initially until therapeutic levels are achieved, and providing dietary education to patients, particularly regarding dietary restrictions, especially vitamin K rich foods. So clients are typically just advised to maintain a consistent diet. Also, assessing the client's bleeding risk and reviewing their medical history would be important for nursing, and implementing bleeding precautions to minimize the risk of hemorrhage would also be essential. So side effects: the primary side effect of warfarin therapy is an increased risk of bleeding, which requires careful monitoring. And warfarin's full anticoagulant effect typically takes approximately 1 week to achieve. And finally, warfarin is contraindicated during pregnancy. It has teratogenic effects which can harm the developing fetus. A client on warfarin therapy for atrial fibrillation presents with signs of bleeding, including easy bruising and melena, bloody stools, and the client's INR is found to be significantly elevated. What should the nurse do initially? A. Administer vitamin K orally. Administer a high dose of warfarin. Administer FFP, fresh frozen plasma, or continue monitoring without intervention. Well, the correct answer is A. Administer vitamin K orally. So when a client on warfarin therapy presents with signs of bleeding and an elevated INR, oral administration of vitamin K is often the initial intervention to reverse the effects of the warfarin. Now, FFP may also be considered in severe cases, but oral vitamin K is preferred for its slower onset and lower risk of complications compared to FFP. A pregnant client with a history of mechanical heart valve replacement is admitted to the hospital, and the client has been taking warfarin but is now facing a pregnancy. What nursing actions are essential in managing this client's anticoagulation therapy? A. Continue warfarin therapy at the prescribed dosage. Switch the client to aspirin therapy during pregnancy. Consult with the healthcare provider to discuss alternative anticoagulation options. Advise the client to discontinue all anticoagulation therapy during pregnancy. The correct answer is C, consult with the healthcare provider to discuss alternative anticoagulation options. So warfarin is contraindicated during pregnancy due to its teratogenic effects, as we mentioned, but the nurse should consult with the healthcare provider to explore the alternative anticoagulation options that are going to be safer for both the client and the developing fetus. So simply continuing warfarin therapy, which is option A, is not recommended during the pregnancy, and aspirin, option B, is not a sufficient alternative for clients with a mechanical heart valve. So discontinuing all anticoagulation therapy, which is option D, is not advisable for clients with mechanical heart valves as it poses significant risks. Therefore, discussing options with the healthcare provider is the most appropriate answer. Now we'll take a look at antidepressants and antipsychotics. Risperidone serves several purposes in mental health treatment. It is effective in treating psychosis in individuals with schizophrenia. And risperidone aids in mood stabilization for those with bipolar disorder. So it addresses both the positive and the negative symptoms of schizophrenia. The positive symptoms are hallucinations and delusions, and the negative are the flat affect and the antisocial behaviors. So for nursing implications, we want to monitor for extrapyramidal symptoms, regularly assess the clients for signs of these extrapyramidal symptoms, which could include tremors, rigidity, and akathisia, and notify the healthcare provider if these symptoms do arise. We also want to do regular assessment of the client's mental status, so we continue to evaluate the client and gauge the effectiveness of treatment and identify any changes. We also want to monitor for side effects. So we have to be vigilant for the potential side effects that include weight gain, metabolic syndrome, neuroleptic malignant syndrome, tardive dyskinesia, anticholinergic effects, drowsiness, and sedation. We want to be cautious with benzodiazepines and alcohol. So we want to advise the clients to use benzodiazepines and alcohol cautiously while on risperidone due to the potential for increased sedation. It would actually be best if they just simply did not use any benzodiazepines or alcohol while taking risperidone. Metabolic syndrome risk. Be aware of the client's risk factors for metabolic syndrome. So risperidone, as we know, can contribute to the development of metabolic syndrome. Neuroleptic malignant syndrome, this is a medical emergency, and if it's suspected, do not administer the drug and contact the healthcare provider immediately. Now, clozapine, just on additional note, is another atypical antipsychotic with a major side effect of agranulocytosis, which would require weekly white blood cell counts to be monitored, and they would dispense no more than 1 week's supply at a time to the client. We would monitor and report signs of infection promptly and have to be aware of the potential for fatal infections and death associated with this clozapine, which is another atypical antipsychotic similar to risperidone. A client has been prescribed risperidone for the management of schizophrenia. What is a crucial nursing action that should be performed to monitor for the potential adverse effects related to risperidone? Should we A, administer benzodiazepines to manage sedation? Should we B, monitor the client's white blood cell count weekly? C, increase the risperidone dosage gradually? Or D, encourage alcohol consumption to alleviate potential side effects? The correct answer is B. We're going to monitor the client's white blood cell count weekly. So risperidone may lead to agranulocytosis, and we know that that's a life-threatening condition that requires regular monitoring of the white blood cell count. And options A, C, and D are just not appropriate actions regarding risperidone administration. A client with bipolar disorder has been prescribed risperidone for mood stabilization. Now, while providing education, the nurse should emphasize the need for cautious use of which substance due to the potential increased sedation when combined with risperidone. Is it A, caffeine-containing beverages, B, herbal supplements like echinacea, C, benzodiazepines, or D, multivitamins? Well, the correct answer is C, benzodiazepines. So combining risperidone with benzodiazepines can lead to increased sedation, and clients should be advised to use benzodiazepines cautiously. When taking risperidone, it would obviously be better that they do not use them at all. And options A, B, and D are not directly related to sedation when combined with risperidone. So haloperidol is a typical antipsychotic that's used to treat schizophrenia and acute psychosis. And it can cause extrapyramidal symptoms. That's one of the side effects. And this encompasses disorders like dystonia, restlessness, or akathisia, or we can see also Parkinsonism symptoms. Now, timely monitoring and intervention are crucial to manage the extrapyramidal symptoms in order for it to be effective. Now, some clients may experience weight gain while on haloperidol, which makes dietary and lifestyle considerations important for them. And haloperidol can also affect the heart's electrical activity. It can potentially lead to prolongation of QT intervals. Therefore, for some clients, ECG monitoring will be essential, especially if they have cardiac risk factors. Restlessness is another possible side effect that requires monitoring, and haloperidol's use will also extend to high doses in cases involving very aggressive clients who require rapid sedation for safety. Haloperidol is also particularly advantageous for our elderly clients as well. It can help reduce falls in that population. Also for long-term maintenance therapy, there is a long-acting form of haloperidol called decanoate that's available. This is also used to help improve compliance with clients who are not compliant. It's administered every 2 to 4 weeks in order to allow the clients time to return for the follow-up injections, and it'll improve their compliance. So when administering haloperidol via intramuscular injection, they have to use the Z-track method. And this is recommended to ensure that it goes deep into the muscle tissue so that it's absorbed, and it'll minimize tissue irritation. And then finally, haloperidol is associated with a lower risk of hypotension, and it makes it a lot more suitable for clients with cardiovascular concerns. A client diagnosed with schizophrenia is started on haloperidol therapy. During the assessment, the nurse observes involuntary muscle movements such as dystonia and Parkinsonism. Which nursing intervention should the nurse prioritize in managing these symptoms? A, administer an additional dose of haloperidol. B, document the findings and continue monitoring the client. C, consult with the healthcare provider to discontinue haloperidol. D, advise the client to increase physical activity. The correct answer is C, consult with the healthcare provider to discontinue haloperidol. So extrapyramidal symptoms include dystonia and Parkinsonism, and it can be a side effect of haloperidol. So when these symptoms are observed, it's absolutely essential to consult with the healthcare provider to discuss the possibility of discontinuing or adjusting the medication regimen. Continuing the administration of additional doses of haloperidol may exacerbate the symptoms, and it is not recommended. So monitoring the client's condition is important, but should be accompanied by the appropriate intervention when the adverse effects do occur. So ensure that we notify the healthcare provider. A client receiving haloperidol therapy complains of sudden, uncontrolled facial grimacing, tongue protrusion, and rapid eye movements. What is the term for these involuntary movements, and what nursing intervention should be initiated? A, neuroleptic malignant syndrome. Administer an additional dose of haloperidol. B, tardive dyskinesia. Document the findings and continue monitoring the client. C, neuroleptic malignant syndrome. Consult with the healthcare provider to discontinue haloperidol. Or D, tardive dyskinesia. Consult with the healthcare provider to discuss medication adjustment. And the correct answer is D, tardive dyskinesia, consult with a healthcare provider to discuss medication adjustment. So the described symptoms in the question are characteristic of tardive dyskinesia, which is a side effect that's associated with long-term use of antipsychotic medications like haloperidol. So when tardive dyskinesia is observed, it's absolutely essential that we notify the healthcare provider to discuss adjusting the medication regimen. If we administer additional doses of haloperidol, it could worsen the symptoms, and monitoring the client's condition is important, but should be accompanied by the appropriate intervention when we see the adverse effects. And neuroleptic malignant syndrome, on the other hand, presents with different symptoms and requires immediate medical attention, but this scenario is not neuroleptic malignant syndrome. If it were, we would also see an extremely high fever. A significant increase in the client's body temperature is what will be a hallmark sign of neuroleptic malignant syndrome, and the client may even see fevers as high as 103 degrees if it were neuroleptic malignant syndrome. Additionally, if it were neuroleptic malignant syndrome, they have muscle rigidity. They also have what we call autonomic dysregulation, where they have tachycardia and hypertension, tachypnea, diaphoresis. They can have dysrhythmias and even incontinence, as well as they could have mental status changes with the neuroleptic malignant syndrome, including confusion and agitation and delirium. And in the worst case scenarios, they could even have coma. They would also have dysphagia. They could have elevated CK levels, as well as leukocytosis and rhabdomyolysis with neuroleptic malignant syndrome. So in this particular case scenario, the question described tardive dyskinesia. So that is the correct answer based on the symptoms of the uncontrolled facial grimacing and the tongue protrusion and the rapid eye movements. Next, we have Aripiprazole, which is an atypical antipsychotic medication used in the treatment of various psychiatric conditions. So what's the use? It's used in the treatment of schizophrenia and bipolar disorder. It has a broad clinical application. It can be used in manic as well as mixed exposures or episodes of bipolar disorder, bipolar maintenance, and it can be used as an add-on treatment for depression, as well as it can be used for managing irritability in autism. So nurses should monitor clients again for extrapyramidal symptoms, which can include the movement disorders like the tremors and the muscle stiffness. Regular mental status assessments, again, are essential to track the client's mental well-being. So aripiprazole has an advantage over the other antipsychotic medications. It's associated with fewer extrapyramidal symptoms and can effectively address both the positive and the negative symptoms of schizophrenia, such as the flat affect, the apathy, as well as the reduced speech. And aripiprazole stabilizes dopamine as well as serotonin levels in the brain. So it's important to be aware of potential adverse effects because these can include neuroleptic malignant syndrome, which represents the high fevers, the confusion, and the tachycardia. And aripiprazole may also carry a risk of rhabdomyolysis, which is the muscle breakdown, kidney failure, seizures, prolonged QT, and abnormal heart rhythm, as well as it can cause elevated suicidal ideations. Weight gain, again, is another possible side effect. Now, there is a black box warning for aripiprazole. Aripiprazole's black box warning says that it has an increased risk of mortality in older adults with dementia-related psychosis. So it is also associated with a potential to increase the risk of CVAs or transient ischemic attacks in clients. And the medication is not recommended for children, adolescents, young adults, or those that have suicidal ideation. So healthcare providers need to continue to monitor for extrapyramidal symptoms, neuroleptic malignant symptoms, and changes in mood, especially suicide ideation. So aripiprazole should not be discontinued abruptly and can have changes in the treatment plan made. And these can be discussed with the healthcare provider so that they can be tapered off. And we would never want to stop these drugs immediately. So clients taking a dissolvable tablet form of aripiprazole should also be advised not to consume food or fluids for 10 minutes after taking the medication. So a client with schizophrenia has been prescribed aripiprazole. The client's family is concerned about the potential side effects of antipsychotic medications and asked the nurse about the advantages of aripiprazole over other antipsychotics. So how should the nurse respond? A, aripiprazole primarily targets negative symptoms of schizophrenia. B, aripiprazole causes severe extrapyramidal symptoms and is not recommended. Aripiprazole stabilizes dopamine and serotonin levels, causing fewer extrapyramidal symptoms. Or D, discontinue aripiprazole due to the risk of weight gain. So the correct answer is C, aripiprazole stabilizes dopamine and serotonin levels and is associated with fewer extrapyramidal symptoms. So the nurse should inform the family that aripiprazole stabilizes the dopamine and the serotonin levels, fewer extrapyramidal symptoms, and it's therefore more advantageous over the other antipsychotic medications. A nurse is providing education to a client prescribed aripiprazole in a dissolvable tablet form. What important instructions should the nurse provide to the client regarding the administration of this medication? Is it A, consume the tablet with a glass of milk to enhance absorption? B, avoid food or fluids for 10 minutes after taking the tablet? C, crush the tablet and mix it with applesauce for easier ingestion? Or D, split the tablet into smaller portions for multiple doses throughout the day? Well, the correct answer is B, avoid food or fluids for 10 minutes after taking the tablet. So clients taking the dissolvable tablet form of aripiprazole should be advised to avoid food or fluids for up to 10 minutes after taking the tablet to ensure that it's absorbed effectively. Sertraline is classified as a selective serotonin reuptake inhibitor, and it is primarily prescribed to treat depression and various anxiety disorders. Now, it is also known for having generally fewer side effects compared to some of the other antidepressant classes, and it may lead to some sexual dysfunction or can also decrease in libido in some individuals. And weight gain is still a possible side effect that's associated with sertraline use. Now, for nursing implications, nurses should be vigilant in monitoring clients for the signs and symptoms of serotonin syndrome, which is a potentially serious condition associated with the overstimulation of the serotonin receptors. And the symptoms may include agitation, confusion, rapid heart rate, dilated pupils, muscle rigidity, as well as tremors. So it's essential to be very cautious about suicidal ideation with sertraline, especially during the early phases of treatment before mood improvement can occur. So nurses should monitor and assess the client's mental status and emotional well-being as a critical component as sertraline is being administered initially. Sertraline's therapeutic effect may take up to 4 weeks to become noticeable, and during that time, clients begin to have more energy and could be at a higher risk for suicide. So sertraline should not be combined with monoamine oxidase inhibitors. Those are the MAOIs, because there is that risk of serotonin syndrome when sertraline is given with MAOIs, and it's a potentially life-threatening condition. So whenever transitioning from MAOIs to SSRIs like sertraline or vice versa, it's absolutely crucial that we allow a 14-day gap between the two medications to avoid any adverse effects. So it is also advisable for clients taking sertraline to avoid substances like St. John's worts and grapefruit, because these can also interact with the medication. A nurse is caring for a client prescribed sertraline for the treatment of depression. What is the primary reason for the nurse's vigilance in monitoring the client's mental status during the initial phase of treatment? A, to assess for weight gain, a common side effect. B, to identify any change in urinary output. C, to watch for suicidal ideation before mood improvement occurs. Or D, to check for signs of serotonin syndrome. The correct answer is C, to watch for suicidal ideation before mood improvement occurs. Again, during the early phase of treatment with sertraline and other SSRIs, there is that potential risk of increased suicidal ideation before the medication's mood improvement effects actually become noticeable. So we need to be vigilant and watch for suicide in the early part of treatment. A client is currently taking a MAOI for depression. The healthcare provider plans to transition the client to sertraline. What is the recommended time gap between discontinuing the MAOI and initiating sertraline to prevent adverse effects? Is it A, 2 days, B, 7 days, C, 14 days, or D, 21 days? The answer is C, 14 days. So to prevent adverse effects and potential interactions, it is advisable to allow the 14-day gap between discontinuing the MAOI and prior to initiating the SSRI like sertraline. A nurse is caring for a client who's taking sertraline for the treatment of depression. Now, the client reports feeling agitated, experiencing muscle stiffness, and notices a sudden increase in body temperature. What is the nurse's priority action in response to these findings? A, administer an additional dose of sertraline as prescribed. B, encourage the client to continue taking sertraline and monitor symptoms. C, immediately discontinue sertraline and notify the healthcare provider. Or D, offer the client a dose of St. John's wort to alleviate symptoms. Well, the correct answer is C, immediately discontinue sertraline and notify the healthcare provider. So this client is exhibiting symptoms that are consistent with serotonin syndrome. And this is a potentially life-threatening condition that's associated with the use of serotonergic medications such as sertraline. So the nurse's priority action is to discontinue the medication and promptly notify the healthcare provider so that further assessment and guidance can be given. Now, administering more sertraline and offering St. John's wort is not appropriate, and it actually could worsen the condition. So monitoring the symptoms without taking the immediate action would be very dangerous for this client, especially in the case of serotonin syndrome. Next, we will cover the anti-epileptics. So gabapentin is a medication with a range of different uses, which includes treatment for seizures, neuropathic pain, post-herpetic neuralgia, bipolar disorder, as well as being used as a prophylaxis for migraines. So nursing implications include keeping an eye on the client's emotional well-being, watching for any alterations in their mood, as well as monitoring for suicidal ideation. So some of the side effects include sedation and ataxia. So clients taking gabapentin, they can experience levels of sedation. So they're advised to be cautious and avoid any activities that's going to require their mental alertness, such as driving, until they actually understand how the medication is going to affect them. Additionally, they can have ataxia. That's the uncoordinated movement. So we want to instruct the clients to be extremely careful, monitor for the side effects, and to take precautions to prevent falls or injuries. So a nurse is reviewing a client's medication orders. Gabapentin has been prescribed. Which of the following conditions or symptoms should be indications for gabapentin? Select all that apply. A, seizures. B, migraine prophylaxis. C, hypertension. D, bipolar disorder. E, anxiety. F, neuropathic pain. And the correct answers are A, seizures, B, migraine prophylaxis, D, bipolar disorder, and F, neuropathic pain. A nurse is administering gabapentin to a client for the management of neuropathic pain. Which side effect should the nurse anticipate as the most common adverse effect of gabapentin? A. Nausea and vomiting. B. Dry mouth and increased thirst. C. Sedation and drowsiness. Or D. Elevated blood pressure. And the correct answer is C. Sedation and drowsiness. So the most common side effect associated with gabapentin is sedation and drowsiness. Now, pregabalin is a versatile medication with several applications. It is primarily used to manage seizures, particularly focal seizures, and it makes it very valuable in epilepsy treatment. Also, pregabalin provides effective pain relief in alleviating neuropathic pain. That's a common condition in diabetic neuropathy. It also plays a role in chronic pain that's associated with fibromyalgia. So whenever we're administering pregabalin, the healthcare provider just needs to ensure that they understand that it has a potential for abuse and dependence. Now, some common side effects to educate the clients about include headache, dizziness, somnolence, and the possibility of weight gain. Now, while it's rare, adverse effects like angioedema, which is a severe allergic reaction, as well as rhabdomyolysis, which is muscle breakdown, should be promptly reported to the healthcare provider. A nurse is caring for a client who has been prescribed pregabalin for the management of neuropathic pain. What is the most crucial nursing consideration when administering pregabalin? A. Monitoring for weight loss. B. Encouraging strenuous physical exercise. C. Assessing for signs of abuse and dependence. Or D. Educating the client about the importance of caffeine intake. The correct answer is C. Assessing for signs of abuse and dependence. So pregabalin has that potential for abuse and dependence. So nurses, we should be vigilant for any signs of misuse. A nurse is caring for a client receiving pregabalin for the management of fibromyalgia. Which potential side effects should the nurse prioritize when providing education to the client? Select all that apply. A. Headache. B. Dizziness. C. Somnolence. D. Weight loss. And E. Photophobia. The correct answers are A. Headache. B. Dizziness. And C. Somnolence. Weight loss is not attributed to pregabalin, weight gain is, and photophobia is not related to pregabalin at all or with the use for fibromyalgia. A nurse is providing education to a client prescribed pregabalin for neuropathic pain management. What should the nurse emphasize as potential serious adverse effects of this medication? A. Weight gain. B. Headache. C. Dizziness. D. Angioedema. And E. Rhabdomyolysis. And the correct answers are D. Angioedema and E. Rhabdomyolysis that are adverse effects. The other conditions, A, B, and C, weight gain, headache, and dizziness, are all side effects that can be managed and are not considered adverse effects. Now, phenytoin is used for tonic-clonic seizures, and it comes with its own set of side effects. So ataxia, which is uncoordinated movements, involuntary eye movements called nystagmus. It also causes sedation, so we need to make sure that the client is aware that they should not be operating any heavy machinery or doing activities that require them to be alert and active. It also causes gingival hyperplasia, which is an overgrowth of the gum tissue. It also causes a rare but very concerning purple glove syndrome that is represented by a very painful discolored hands as well as the arms. Also, phenytoin can result in hirsutism, which is an overgrowth of hair that can lead, and also it can lead to anemia where there's a reduction in the red blood cells. Additionally, phenytoin has its own adverse reactions that includes a mild rash that can escalate into a severe condition like Stevens-Johnson syndrome or toxic epidermal necrolysis or TEN. And that is characterized by red lesions and skin blistering that need to be monitored. So to achieve safety for our clients, we need to give them proper education, but in addition, we need to monitor their phenytoin levels. And in order to do so, we need to be aware that the therapeutic range for phenytoin falls between 10 to 20 micrograms per milliliter. A nurse is preparing to administer phenytoin to a client with tonic-clonic seizures. The client's latest phenytoin level is 25 micrograms per milliliter. What action should the nurse take before administering the medication? A. Administer the medication as prescribed. B. Hold the medication and notify the healthcare provider. C. Increase the phenytoin dosage. Or D. Administer the medication but closely monitor for adverse effects. The correct answer is B. Hold the medication and notify the healthcare provider. So we've mentioned that the therapeutic range for phenytoin typically falls between 10 to 20 micrograms per milliliter. So this client's current phenytoin level of 25 micrograms per milliliter is above the range, including a potential risk of toxicity. Therefore, it's essential to hold the medication and notify the healthcare provider. A nurse is assessing a client who is taking phenytoin for seizure management. The client complains of gingival hyperplasia. What should the nurse advise the client to do? A. Discontinue phenytoin immediately and inform the healthcare provider. Increase the dosage of phenytoin to control gingival hyperplasia, which is B. C. Practice good oral hygiene techniques such as flossing and gum massage. Or D. Ignore the symptoms as gingival hyperplasia is a common side effect of phenytoin. Well, the correct answer is C. Practice good oral hygiene techniques such as flossing and gum massage. So the nurse should advise the client experiencing this gingival hyperplasia that it is a potential side effect of phenytoin, but they should take the actions of doing good oral hygiene and practicing activities such as flossing and gum massage to help with the gingival hyperplasia. A nurse is assessing a client who has been taking phenytoin for seizure management. During the assessment, the nurse observes that the client is pale and fatigued. The client reports feeling unusually tired and experiencing shortness of breath. What actions should the nurse take? Administer an additional dose of phenytoin to manage fatigue. Document the findings and continue monitoring the client's condition. Advise the client to practice good oral hygiene for gingival hyperplasia or recognize the potential for anemia and arrange for a CBC. Well, that's clear that the correct answer is D, to recognize the potential for anemia and arrange a CBC to assess for the client's hemoglobin levels. So this client's symptoms of paleness, fatigue, shortness of breath could be indicative of anemia, which is a known side effect for phenytoin due to the potential for bone marrow suppression. So therefore, the nurse should recognize that the client potentially has anemia and arrange for a CBC by notifying the healthcare practitioner and getting that order completed. A nurse is caring for a client with a history of seizures who receives intravenous phenytoin for poorly controlled seizures. The next day, the nurse observes bluish discoloration and swelling in both upper distal extremities, indicative of purple glove syndrome. What orders would the nurse anticipate receiving from the healthcare provider? Is it A, continue the IV phenytoin as ordered, B, document the findings and continue to monitor, C, change the seizure medication to an alternative and consult a vascular specialist, or D, discontinue phenytoin and order a vascular specialist? Well, the correct answer is C, change the seizure medication to an alternative and consult a vascular specialist. So changing the seizure medication allows for the management of the seizures to continue versus just completely stopping the phenytoin. And we're also going to address the complication of the phenytoin extravasation as well. So consulting a vascular specialist is also essential to manage the vascular complication associated with the purple glove syndrome. This can be seen at times. It's rare, but it can be seen with patients that are taking IV phenytoin, and the need for the vascular surgeon is to ensure that there is no compartment syndrome that gets developed so that this purple glove syndrome can be taken care of before it causes a permanent damage to the client's arm. A nurse is providing care for a client receiving phenytoin for the management of seizures. The client reports experiencing double vision and difficulty focusing, and the nurse observes nystagmus during the neurologic assessment. What action should the nurse prioritize in response to these findings? A. Administer the scheduled dose of phenytoin. B. Document the findings and continue to monitor the condition. C. Notify the healthcare provider of the client's symptoms and request an eye examination. Or D. Increase the frequency of neurologic assessments to monitor for further changes. Well, the correct answer is C. Notify the healthcare provider of the client's symptoms and request an eye examination. So in this scenario, the client reports double vision, difficulty focusing, and nystagmus, which are indicative of potential side effects of phenytoin. So the nurse should prioritize notifying the healthcare provider and making them aware of the client's symptoms and request for the client to have an eye examination. When educating a client prescribed phenytoin for seizures, what adverse reaction should the nurse stress as a reason to promptly contact the healthcare provider and stop taking the medication? A. Mild headache. B. Nausea and vomiting. C. Mild rash. Or D. Red lesions and skin blistering. Well, the correct answer is D. Red lesions and skin blistering. So phenytoin can cause a mild rash, and this rash can progress to a severe condition like Stevens-Johnson syndrome or toxic epidermal necrolysis, and that is characterized by the red lesions and the skin blistering. So it's definitely important at that point to stop the phenytoin from being administered and notifying the healthcare provider immediately. While providing care, a client who is taking phenytoin approaches the nurse with concerns about excessive hair growth on her face and chin. The nurse recognizes this as a potential side effect and attributes it to what factor? A. The client's dietary habits. B. An underlying hormonal imbalance. C. The use of phenytoin medication. Or D. Seasonal variations in climate. The correct answer is C. The use of phenytoin medication. Now, excessive hair growth or hirsutism can be a recognized side effect of phenytoin medication. Therefore, the nurse should consider phenytoin as a potential cause and engage in further assessment and education of the client, as well as notification of the healthcare provider. So that concludes our lesson today on NCLEX drug reviews. We will be back with part 2 soon with more drugs that you need to know in order to do well on your NCLEX exam. So we hope you liked the video. If you did, please give the video a thumbs up and subscribe to the channel, and we will see you in part 2 in our next video.